So, first of all, thank you so much, Colonel, for joining us for today's meeting. So, first of all, I would like to introduce you to my audience, to my viewers. Today, we have with us Colonel Hemraj Singh Parmar, who had served the Indian Army for 23 years of dedication. He left Indian Army with the position of Director Healthcare. After that, he has joined many healthcare organizations in top-notch positions. And at present, he has founded a health tech company, and he's a co-founder of the health tech company known as DoctCo. Basically, DoctCo is a health tech company that is redefining the surgical and telemedicine experiences among the tier 2, tier 3, as well as rural parts of India by bringing in affordable as well as high quality healthcare services. So apart from before founding the DoctCo, he was serving as the Group Chief Executive Officer of BR Life, Group Chief Operating Officer at IB Hospitals, and Chief Operating Officers at Global Hospitals. So it's a sheer pleasure to host you, Colonel. So, and I would like to also thank you so much for accepting our invitation to serve as a member of the eminent or the esteemed industry advisory body of the board for the MBA Hospital and Healthcare Management program at IIM Bodh Gaya. Thank you so much again.
Thank you.
Yeah, with your due permission, can I ask you a few questions?
Certainly. Thank you so much, Professor. It's a pleasure indeed to interact with you. We can start with the discussion.
Yeah, okay, thank you. So, Colonel, I would like to ask you or start like this. Since you have got huge experience in the healthcare industry and specifically into hospitals and now into health tech kind of thing, based upon your huge experience, can you just tell us what has been the recent trends in the healthcare industry in India? And again, how do you see that the future is going to be for the healthcare industry in India?
So thank you so much, Professor. As you know, the healthcare industry is the biggest industry globally. And it's also one of the most vibrant. You take the case of the US, they spend almost 20% of their GDP on healthcare. They have a size of almost $25 trillion.
Yes.
And we in India spend close to 5%. We have a size of economy size of $3.5 trillion. In the last budget, the government of India allocated almost 2.1% of its GDP to healthcare industry, and this number is likely to increase to 2.5% of the GDP by 2025. Most of the advanced economies spend anything from 8 to 10% of their GDP in healthcare. So our spend on healthcare as a percentage of the GDP is still abysmal. In fact, the size of the US healthcare industry is much bigger than the entire size of the Indian economy. The current size of the Indian healthcare industry is around $372 billion, and it's one of the biggest employers with almost 4.7 million people working in the industry. In the last budget, we allocated around 86,000 crores or $11.3 billion. Our out of pocket expense is still very high. Consider this, the health insurance challenge across the country is very grave. The bottom 50% of the population is covered under the Ayushman Bharat. The top 20% is covered with private insurance. Is the middle 30% which still is uncovered. So the burden is very large. The COVID pandemic, exposed our vulnerability and gaps in the healthcare delivery. Our health systems were totally overwhelmed. We did not have beds. We did not have life-saving medicines, oxygen cylinders, concentrators. Nothing was available, and we lost a lot of precious lives. The Ayushman Bharat initiative has proven to be a path-breaking initiative. And this could well be the first step towards value-based care and also the universal health coverage, which we have been planning for so many decades and which we so desperately need. With this, the government of India has become a net payer, the typical role of TPA or, the insurance companies. Under this scheme, We will cover almost 10 million families, 100 million families across the country. Almost 40 to 50 crore people will be covered. We have already empaneled more than 23,000 hospitals across the country. More than 10 crore people have been registered.
Wow.
4 crore Ayushman Bharat health accounts, or ABHA, unique ID of the patients has been created. The accent now, as far as the government of India is concerned, will be on preventive medicine rather than the management of, episodic management of diseases, which we
Okay.
have been so far following. And
Yes.
as you know, we are currently sitting on a huge non-communicable disease bomb. The focus of government of India on primary healthcare will only increase in the times to come. In 2019, the government of India plan to open 1.5 lakh wellness centers. And in the primary healthcare currently, the involvement of the corporate providers is almost zero. So more than 86,000 clinics have already been put in place. There is going to be a lot of focus on Ayush, an industry which has grown to almost $18 billion from a size of $3 billion in 2014. One of the major challenges in healthcare delivery, professor, in tier 2, 3 cities and rural areas is the lack of access to super specialty care. Some of the new age health tech companies such as DoctCo are trying to bridge this gap. So, for example, in DoctCo, we wish to bring super specialty care at the doorstep of the patients in tier 2, 3 cities and rural areas through state of the art telemedicine equipment, which is equipped with Internet of Medical Thing devices, and we take help of predictive analytics to carry out the requisite intervention on the patients long before a major illness or disease strikes the patients. As a mega healthcare trend, the healthcare delivery itself is moving away from the healthcare facilities, and post pandemic there has been an upsurge in the large number of these remote care healthcare facilities through e-clinics, e-diagnostics, and e-pharmacies. A lot of these hospital groups, especially the bigger hospital chains, also have established remote ICUs. As you know, there is an acute shortage of the super specialist and critical medicine specialists, and we realized this during the COVID pandemic. So through these remote ICUs, we are able to look after a large number of people through these command posts, which are located centrally, and we are able to monitor a large number of patients and provide them the right kind of treatment. Telemedicine wearables are really making tremendous difference. In future, artificial intelligence is going to play a major role in the healthcare delivery. We have the robotic surgeries, most of these hospital chains, although the equipment is currently very expensive. But through the robotic surgeries, we are able to carry out precise surgeries with minimal cuts and, with minimal damage to the nearby tissue. This not only ensures faster recovery, but also quicker discharge of the patients with excellent outcomes. In future, we are going to see a lot of these hospitals and healthcare facilities equipped with HIPAA compliant, cloud based, EMR, EHR systems. Augmented and virtual reality are going to make a lot of difference to the quality of care and also for the delivery of medical education. Wearables are making a lot of difference to the market. Apple, Samsung, and so many other companies are coming up with state of the art wearables which can monitor the clinical parameters in real time frame and pass it on to the clinician who can take the required intervention at the right time. 3D printing of organs is going to happen in future. You would have heard that one patient in the US recently got the heart of a pig. Although the
Yeah.
patient did not survive, more than 2 months, but it was a path-breaking surgery. Similar transplant was carried out on a patient for heart in 1984. So in future, 3D printing is going to be, the driver in organ transplant. There's a huge demand for organ transplants in India and, of course, globally. A lot of these organs can only be harvested from a deceased donor. Precision medicine is going to play a critical role. Targeted therapies, on the patients depending on his genotype. Gene editing of the patients, of the embryos, before child is even born, to prevent any major illnesses in future. India played a critical role during COVID pandemic, and two vaccines, Covaxin, which was jointly produced by Bharat Biotech and ICMR,
Yes.
and Covishield by the Serum Institute of India, played critical role in saving millions of lives
Millions of lives.
across the globe. So, if you see, Professor, the aim of all these initiatives in future will be to improve overall patient experience and outcomes. As you know, medical tourism, or medical value travel, as we call it, is going to play a major role. Currently we are catering to large number of patients coming from Africa, Middle East, and the SAARC countries. We have more than 40, we have close to 40 JCI accredited hospitals and 1400 plus NABH hospitals, which give state of the art treatment at almost 1/5, 1/10 of the cost of what these advanced healthcare markets offer. In 2019, we handled close to 7 lakh patients, and we as a country, Professor, will not only be providing healthcare delivery to 1.4 billion Indians, but also to billion plus people residing in Africa, Middle East, SAARC countries, and some of the countries in the Far East. The size of the medical value travel industry in India was around $5 to $6 billion in 2020. This is likely to increase to almost $13 billion by 2026. It's a huge industry. In the healthcare industry, we are getting a lot of investment, and in the greenfield projects, we can get 100% investment through the automatic route, but in the brownfield projects, we can get 100% FDI through the government route. So the government of India has simplified the investments, and as you know, that India has emerged as the third largest startup ecosystem in the world, with the healthcare industry getting good funding and traction. Make in India is making tremendous impact to reduction of our import bill, and also providing state of the art equipment to our healthcare facilities, which brings down the the break even periods when a new healthcare facility is commissioned. So I think overall the future looks extremely bright.
So the Colonel, I ask you to bat, and you batted on and on and on for the last 7 or 8 minutes. So I was actually swayed by the data points that you actually shared with us. Fantastic, really. That shows that the knowledge of the healthcare industry that you have, and the kind of contributions also that you have made and going to make in future to the healthcare industry. Hats off to you, Colonel. Thank you so much for this information. So going to the next question, Colonel, we are talking about now, like management education. If we talk about management education, is gradually moving from general management education to some kind of niche management or niche areas, or specific to industries, because we feel general management or managing just general functions across industries are actually different. So management is moving from general management to niche areas of management or industry specific management. So in that context now, healthcare management or hospital management courses are also getting popular. Can I ask you a question, or do you feel that does the healthcare industry really require this professionally trained manpower in the area of hospital and healthcare management? If at all yes, then what are the different areas actually they are fitting into in the healthcare industry?
Excellent question, Professor. The talent management, both clinical, operational, in the healthcare industry has always been a challenging area with huge shortages across the industry. Currently the industry employs almost 4.7 million people, one of the biggest employers, right? Our, the doctor and nursing ratios are still below par. We have just 1.7 nurses per 1,000 people, whereas the WHO standards mandate 3. We are already inching closer to 1:1,000 ratio for the doctors, so pretty much close to what the WHO prescribes. India has 2.34 million registered nurses and midwives. More than 6.4 lakh nurses are working outside the country, contributing to the healthcare delivery in Middle East and some of the other countries. We currently have around 1.3 million allopathic doctors and about 6 lakh Ayush doctors. So Ayush is also contributing very efficiently to the healthcare delivery. So there is still an overall shortage of about 6 lakh doctors and about 2 million nurses. In the last 10 years, we have been able to build a large number of medical colleges, educational institutions which teach healthcare management. We currently have around 612 medical colleges, up almost 157 from 2014 when the number was much smaller. So as far as the opportunities for the healthcare management professionals is concerned, we have more than 70,000 hospitals across the country, big and small. There are a large number of medical devices companies, clinical research organizations, insurance companies, telemedicine companies, new age health tech, med tech companies, medical value travel or medical tourism companies, pharma industry. See, all these industries require people in operations, marketing, branding, and PR, HR, IT, and other allied healthcare professionals. Even some of the big IT companies such as Infosys, TCS, Cognizant, they also require a large number of these professionals, catering to the Indian, European, and American markets. So I see opportunities galore for well-trained professionals in future.
Yeah, thank you. Thank you so much, Colonel, for the answer. Coming to my next or the last question. So now you are serving as the esteemed member of the Industry Advisory Board for this MBA Hospital Healthcare Management, because we feel that with your expertise and knowledge, you will help us to make this program more industry relevant and increase our presence in the healthcare industry. So in that context, can you please give us your opinion about IIM Bodh Gaya's MBA Hospital Healthcare Management program? And would you give us, or would you give the candidates who are aspiring to make their careers in the managing healthcare businesses, like leave us with some kind of valuable message from your side?
I think, Professor, it's a step in the right direction, and it has come none too soon. This will help. This course will help bridge the prevailing talent gap in the healthcare industry in management professionals. This is also going to contribute to our projections for $5 trillion economy by 2025. These are the professionals who will drive the healthcare industry, and healthcare industry is going to contribute immensely to that endeavor. Now, as far as my message to the candidates is concerned, this is one of the finest industries. This is unlike any other industry. Human lives are involved, much like aviation. One mistake and a life is lost. So patient care is a very noble endeavor. Profits are absolutely secondary, and everything will fall in place provided there is ethical propriety. The three key pillars of healthcare delivery are quality, access, and affordability. You must focus on them. Patient trust is a major challenge prevailing in the healthcare industry currently. There is a lot of trust deficit. The patient think the healthcare facilities are looting them, overbilling them, and we are very opaque about our pricing and overall patient handling. So patient centricity should be the focus for these budding professionals. Make the best of this interaction with industry veterans who have muddied their hands in the mud, while handling the healthcare facilities, and learn the critical nuances of healthcare management. This is a wonderful opportunity. Dwell on the professional excellence and ethical functioning, which is more important than anything else. Enjoy this process of learning, and I'm sure you have a very bright future ahead.
Yeah, so great message, Colonel. Really impressed with your three-letter QAA. That's quality. Then you said affordability and accessibility, right? To create that patient trust, and finally have that happy patients patients and create that beautiful patient experiences. That's the key that we should also imbibe in our training into our students. And obviously, yes, this training will be obviously a great value additions to our students with your guidance. Thank you so much, Colonel, for joining us. So we will look forward to interacting you much more. Thank you again.
Pleasure interacting with you. Have a wonderful day ahead.
Thank you.